Good morning. Woo, it's loud. I'm going to back away a little bit. It's my pleasure to be here this morning. I'm Jan Holden. I'm a professor of counseling at the University of North Texas, and I'm introducing myself. I know that Debbie and other people are very busy, so I just volunteered to introduce myself. I began studying near-death experiences during my doctoral dissertation research back in the mid-1980s, and I've been researching them ever since. It's been a source of fascination and very profound inspiration to work with all the near-death experiencers and people interested in this phenomenon. So today I'm going to tell you about one of our recent studies, and although the slide says that my co-presenter is, the slide will come up here in a minute, I guess. Well, let's see. Yeah. It says that my co-presenter is Kinsey. He actually is not here today, but I wanted to credit him because he was very much a contributor to what you're going to hear today. So the purpose of this study was to, that to date the professional near-death literature contains anecdotal data or cases and some indirect research data and very small-scale studies about near-death experiencers' experiences of disclosing their NDEs to healthcare professionals. And to jump back to the anecdotal data, Linda Jacquin, some of you may have heard her speak. She has talked about a very upsetting experience in which she was diagnosed as having a mental illness purely on the basis of having disclosed a near-death experience. It was completely unfounded, and in fact, Dr. Grayson helped her get it expunged from her medical record. But it was, obviously very upsetting, and she had to go to a lot of trouble to right this clinical wrong. And Ray Kinman talks also about distressing experiences disclosing his NDE to, in fact, his first disclosure was to a religious professional, and the response he got was so negative that he stopped talking about the experience and didn't start again for more than 2 decades. During which time he said that holding it in and not being able to talk with anyone about it that he felt would understand him was very traumatic and psychologically damaging, psychospiritually damaging. So there has not to date been any large-scale studies using quantitative methods to assess NDErs' experience of disclosure. So that's what we wanted to undertake in this study. So part of my inspiration came from Leslie. She is an employee of my university, and she she's in communications, and when she first got her job, she's at the university level of communications. She came and visited my college's communications person, and that person happened to have been interested in NDEs, and she had a copy of the Handbook of Near-Death Experiences in her office. So when Leslie went to visit her and make a contact, she saw that book and she said, "What is that about?" And our communications person told her, and Leslie said, "Oh, that happened to me." And she said, "There's a name for that?" And this was not many years ago. And so Leslie came to talk with me, and you'll actually hear her refer to that first conversation in a next excerpt. But in this excerpt, let's see. What's happening? Here we go. So let's see if we can get it here. So Leslie, thank you for agreeing to this interview. I'm glad we have an opportunity to talk today about your experience surrounding your car accident and afterwards.
Yes.
Yeah, so tell me briefly who you were leading up to your car accident.
I was 17 years old. I lived in rural North Carolina, and I was just a high school student and, inexperienced driver. And so, you always make mistakes when you're an inexperienced driver. So I was hanging out with friends, and we decided to take a trip down a dirt road to a friend's house, and it sort of just completely changed my life after.
So what happened exactly?
Well, we were, we made all of the wrong decisions right away, and then we didn't wear seatbelts because we thought, oh, it's just right down the street. Not familiar with driving on long gravel roads, and so going too fast, not paying attention. What caused the accident was a dog ran out in front of the car, and at that age, you don't have the self-control to just keep going, not swerve, and so I swerved, and the truck rolled over, and I was thrown out partially, and the truck landed on my head.
Wow. So, what did you experience subjectively while this was going on?
What I remember is I could feel the moment that the truck was out of control, and so I could feel a lot of bouncing, and I knew that my hands weren't on the wheel anymore and something was wrong. The last image that I remember seeing was the starting to roll, and I could see trees off in the distance. After that, I remember seeing from up in the air what was going on, and then the first thing I remember being on the ground was feeling the gravel on my face.
So if you had to estimate how long you were in that perspective up in the air, what would you guess?
Maybe 15 seconds,
15
20
seconds, yeah. And what did you see while you were from that perspective?
I could see the accident happening sort of almost seems like to the bottom of my vision, my field of vision, but mostly I saw trees and I saw the sky, and I could hear wind blowing, and I could hear birds.
And what were you feeling emotionally?
It was very peaceful. It was the most peaceful thing I've ever felt.
Wow.
And it was, even though you could see the accident happening, I wasn't anxious about it. I didn't have it just wasn't a concern at all. I mean, I felt so peaceful.
How aware were you that was your body down there and it was happening to your body?
I knew, but I guess the feeling was it was over, and it was just not a concern. Because I knew that's what it was, and I knew that I had come from that, but it didn't bother me.
It just didn't bother you. Okay.
Yeah.
Anything else about the experience itself that has stayed with you?
Yeah, one thing that stayed with me, and that it's a difficult thing to explain, is the transition from that really peaceful place back to being on the ground, and the violence of it, and the sounds and things, because it was so peaceful and it was very quiet. You could just sort of hear a breeze and birds, and then so quickly I was back to feeling, I could hear my friends screaming, and you could feel blood and the gravel and the dirt on the ground, and I could hear the truck, my skull had fractures, and I could hear my bones popping, and it was the transition from this peaceful place back to this noisy, scary, violent places. That transition has stuck with me.
Yeah, and what would you say about the transition?
It's just one thing that's hard to understand it, I guess. It's, you think back on how peaceful it felt and how good it felt and how it was so calm, no concerns, no worries, to that, scary place. And in a way, I feel like it may have been a little bit of a blessing to not have experienced all of it from inside the truck that way. But it is something that's just fascinated me forever, is that immediate transition from the nice, peaceful feeling to the very scary.
Yeah. Did you actually feel yourself re-enter your body, or it just somehow happened?
It just happened.
It just happened. And like 1 minute you're in the peaceful place, and the next minute you're back in your body. And yeah.
It was almost like I'd blinked. It was just a quick one place to the next.
Yeah. And you were still conscious in physically. And what happened in terms of remaining conscious for after that?
I was conscious after that, and some people who had seen the accident happening came over to. The truck landed on its driver's side, and so I was sort of under it, and it was on my head, and they pushed, and I was able to climb out, and I was conscious after that and waited for the ambulance to come.
Wow, okay. So if you're familiar with near-death experiences, what she's describing is pretty textbook, and it's not a particularly deep near-death experience in the sense of there being, she had what I refer to as a material aspect NDE, meaning that she observed the material world from this position outside of her physical body. She didn't proceed into a transmaterial domain where she, met deceased loved ones and all of that. It was a very straightforward material NDE. Despite the what seems like very textbook to me and other people who studied NDEs, here's what happened when Leslie began disclosing her NDE to some healthcare professionals. Oh, I'm sorry. First, we're going to talk about the Aftereffects. She reported that religion became unimportant to her, even though she'd been fundamentalist Christian previously. And she had been previously very concerned about adhering to religious doctrine. And after her NDE, she found those concerns to be petty. That was her term. She lost her fear of death. She learned that death is not lonely. And it was interesting that I asked her, even though you didn't perceive any other entities or anything, you didn't feel lonely or alone. And she said no, even though there wasn't any discernible other presence there. So it was not a lonely experience, profoundly peaceful. And she described it as a condition in which all her needs were met, or maybe she just had no needs, but it was that kind of experience. And so here is what happened when she began telling her NDE to healthcare professionals. And then you mentioned that you talked with your pastor. Mm-hmm. How was that conversation for you in terms of his, it was a he, his response?
It was a little difficult at first. His take on it was that it was all planned, that there was a reason, and his take was that it had happened to teach me something or to signal something to me, and that it was God who stopped the accident, who helped me, who made sure that my friends and I lived through it. But to me, I kind of felt like the more that I thought about it and the more that I would kind of go review what had happened in my head, I thought it just happened. There's, it's just things happen in the world, and it happened. Maybe it did happen for a reason, but I don't think it's something that I can know. Mm-hmm. And the idea that there would be one being or one person kind of focusing on this particular event and managing things that way was sort of outside of my comfort level. Mm-hmm.
So it sounds like he had a kind of a pre-planned, or not pre-planned, but a preordained sort of perspective on it, mm-hmm. and imposed that interpretation on it that just really didn't fit for you. Mm-hmm. Yeah. And it doesn't, I'm gathering, so correct me if I'm wrong, that he didn't ask you what you thought, or even what you thought of his interpretation.
No.
Mm-hmm. So you've just come to your own understanding of it, sort of more on your own. Mm-hmm. Mm-hmm. Yeah. Yeah. And then, have you tried telling any other people about your experience?
It took probably 7 or 8 years before I talked about it. I did tell my doctor, mm-hmm. When I was in my follow-ups and things like that with doctors. I did mention it immediately in the emergency room and in ICU. I was so out of it. There were so many other things going on that it didn't occur to me. But in the follow-up consultations with doctors, I'd mentioned it, and I got a very bad response from doctors. And it took me a while to talk to my family about it because I was worried about what they would think about me. Mm-hmm. Mm-hmm.
So tell me more about your experiences with doctors.
I had several consultations after the accident where they would come test my eyesight and my coordination and to see if there was brain damage or anything like that afterward. And they would ask, well, did anything else happen? Do you have any questions? And a couple times I had mentioned that I had this experience where I could see the accident happening from up in the air. And the reaction I got was a distinct concerned face, sort of like, really concerned face. And I was told that I could be referred to a therapist or someone who could talk to me about my thoughts on it. And I kind of it made me feel like that meant something was wrong, so I didn't really want to bring it up anymore.
Mm-hmm. So you sort of shut down from bringing it up, but it sounds like you brought it up more than once, so you were looking for something. What were you looking for?
I think validation that it wasn't, that I didn't imagine it.
Mm-hmm.
Yeah.
Mm-hmm. Yeah. So it sounds like even though it seemed, from the way you describe it, it sounds like it seemed like very real and like kind of natural, that because it was so different from anything that you had known before or been prepared for, you still questioned and wanted that kind of validation. Yeah.
And I think too, my age was a big part of it. I was so young that I wanted to make sure that I wasn't, I guess, I hate to say crazy, but that I wasn't, thinking something that couldn't be possible, or I couldn't have just had some kind of other experience that didn't really fit with what I thought happened. And so I had hoped that a doctor would be able to say that this is common, this happens in the world, and there's someone to validate that and comfort me.
Yeah. So she encountered some common errors that healthcare professionals can make. The minister imposed an interpretation on it rather than at least first asking her, what it meant to her, what she made of it, and even to offer a possible other perspective, but do it in a hypothetical way or a tentative way, so that she had the right, so to speak, to agree or disagree with it. But that doesn't seem like what happened. And then the medical professionals, when she first came to talk with me, she told me about the doctors, and she made that face, that like drawing back frowny face, like, what? And that's when I thought, I've got to video this person doing this so I can show this to healthcare providers and say, this is the face not to make when someone tells you about their NDE, what kind of face. And she was just she had had an experience that was so different from her previous experience of reality that she wanted some affirmation, some validation, that if she had been speaking with healthcare professionals who were knowledgeable about NDEs, they could have easily provided to her and said, well, what you're describing sounds like it might be what's called a near-death experience, and thousands of people have reported similar experiences, and if you want to learn more about it, I can give you some resources. That would have been ideal, but again, not what happened. So just to show that there can also be positive experiences, here's Leslie again talking about some positive disclosure experiences. I know that you first really, if I remember correctly, you first really understood that what you'd had was a near-death experience after we talked at some point, that you had seen a book on a colleague's desk and asked about it, and then got directed to me. And how would you describe the way that I reacted and what effect that had on you? Now, obviously, she has to say positive things.
You were very understanding and validating, and it was fascinating, because when I remember seeing the book and I'd asked, well, what is the book about? And someone explained it, and I thought, there's a book about what happened to me. This is real. And I never had a name for it. I never knew how to really explain it. And so seeing the book and being able to talk to you was eye-opening. It was amazing to know that it is something that happens. It's real. Other people have the same experiences, and it's okay.
Yeah. And then where were your disclosures to your family in relationship to that conversation with us?
Maybe it was not too long after, maybe within a couple months after. And in particular, I had been concerned about talking to my mom. My grandma had died not too long ago, and she was very, very sick and had a very difficult time. She had cancer and lots of other problems, and she passed away. And my mom, I know, carried a lot of guilt and worrying that the passing was bad and the passing was, scary for her. And I had wanted for a while to tell her that no, it's not scary. I know that she was peaceful. I know that it's okay. And so I finally talked to my mom about it. It was a great conversation.
Great.
And my mom was very open, and she was very accepting of everything.
Wow. So that must have been a relief to you, that she was open and accepting in general, but then also that it sounds like she was able to really accept what you were saying and internalize it and feel less guilt and more kind of comfort and reassurance. Yeah. I wonder if it sounds like what you're saying is that your experience also affected your experience of grief with your grandmother. Maybe I don't know if anyone else has died, but I wonder if you could say anything more about that.
Yeah, it makes me happy because I think often, and I know before I had my experience, I thought death was very scary. It was very lonely. It was something that you would think, what's going to happen to my family? What happens, what do I do? I'm going to miss them. It was this sad experience. But then after the accident, I realized it's really not sad, and I think that's hard to explain to someone who's never been in the same situation, but it's not at all. It's very peaceful, and it's sort of a peace that you can never experience here. And now that I know that, I feel better knowing, like, I have a grandma who's getting very high in her years now, and so I feel a lot better when I go visit her, knowing that it won't be bad, it won't be ugly.
And in your experience, it sounds like you didn't sense the presence of any other entities or deceased loved ones or anything like that, and still you wouldn't describe the experience as lonely. No, because you felt so peaceful. It's like you felt no need for anything else. Okay, so here's what we wanted to find out. How frequently do NDErs disclose their NDEs to various healthcare professionals? There'd been some hint in the literature and from other smaller scale studies that maybe to healthcare providers sooner than others, which would make sense. When a person first regains consciousness after a close brush with death, the likely people nearby are healthcare professionals. But we wanted to see the frequency. To what extent do they report that their disclosure experiences were negative / harmful versus positive / helpful? To what extent did the quality of disclosure vary by the type of healthcare professional, the year of the NDE, and the immediacy versus delay of disclosure? So in other words, do people have better disclosure experiences or worse disclosure experiences depending on who they're talking to when they had their NDE, the assumption being that, we now have 40 years of research on these phenomena. Have disclosure experiences gotten better over the decades? And as presumably healthcare professionals become more knowledgeable about NDEs, and if people wait to talk about it, might they have more positive experiences based on things like the possibility that they become maybe a little less emotional, a little more organized in the way they describe the experience, or maybe or become more discerning who they talk to. They may learn through experience who they can feel safe disclosing to and getting a helpful response. So, and also the depth of NDE. Is it possible that people with deeper NDEs maybe have more positive or more negative disclosure experiences? So our method was to get approval from our IRB and invite participants through near-death experience groups, including INs and NDERF. And if you are familiar with INs, there are 50 or more local groups around the U.S. and actually around the world. But most of them are in the U.S., and we have a network where we can send an invitation to participate in research to the leaders of these groups, and they then convey them to the participants of their groups. And we also posted advertisements on Facebook targeting groups interested in NDEs and other spiritual phenomena. Actually, Lee did that. I don't know the first thing about Facebook, so this is what graduate students are made for. So people completed the survey online via Qualtrics, which is like SurveyMonkey. Some of you may be familiar with these kind of things. Or they could do it by hard copy, and then we entered it into Qualtrics so that we could analyze the data with those results. The survey itself took anywhere between 15 and 60 minutes, depending on how many NDEs they wanted to talk about or had, and how many disclosure experiences they wanted to talk about. And so we asked for demographics, asked how many NDEs they had, and for each NDE, the participant completed the NDE scale that Bruce Grayson developed back in, published first in 1983, and the LCIR, which is the Life Changes Inventory Revised about Aftereffects. So the NDE scale assesses the quality of the experience itself, and the LCIR, the Aftereffects. For each NDE, we asked the person to indicate all the health professionals to whom they had disclosed, and then we asked, of the disclosures you indicated above, please choose up to 3 that you consider the most noteworthy for whatever reason. So we wanted to know, which ones do you remember? And we didn't make any presumption about, whether it was a positive or negative experience, just which ones really stick with you or stand out in your mind for whatever reason. And for each disclosure, the participants completed the needs. Now, the needs is the near-death experiencers' experiences of disclosure scale. And we developed it for this study to assess NDErs' reported perception of the quality of the experience of disclosing the NDE to someone else. And so the needs has 16 items consisting of 4 subscales, each with 4 items. And those 4 items, 2 of them are worded positively and 2 negatively, so that we were not getting response bias. And the 4 subscales address whether the person, the confidant, the person to whom the NDEer disclosed their NDE, recognized the experience as an NDE, considered it real or at least potentially real, was open to the possibility that it was real, didn't automatically say, oh, that was a hallucination or that was a dream, or discounted in some way. The extent to which the confidant pathologized either the experiencer or the experience, essentially said either you or your experience was crazy, and the extent to which they demonized it, said, oh, this is, evil and you should stay away from it, or spiritually potentially positive. So, and it was a Likert type scale, so for each statement, the person indicated the extent to which they found the statement completely true or completely false. So here's an example for the real. One of the statements is, the professionals seemed to believe the NDE was a real experience, and that was worded positively. And the professionals seemed to consider the NDE a dream, hallucination, or other unreal experience, and that was worded negatively. So you see the kind of balance. And so here are our results. First, our completion rate. 171 people began the survey online. 105 completed it, and which is a 61% completion rate. And of those 105, 88 scored 7 or higher on the NDE scale, indicating that's kind of the industry standard for saying that we feel confident that this was an NDE. Not that a score below 7 isn't, but 7 helps us feel confident that it was an NDE. And of those 88, 72% were women, 28% were men. NDEs actually occur not more among men or women, so the fact that we have more women respondents may have to do with the fact that women do tend to volunteer more often for research. And the ages range from 21 to 81, with the mean age being 56, so it was quite a nice range of people. We had almost all Caucasian, and you can see a few other ethnicities represented there. And then we got a kick out of this. One person wrote in human, and we thought that's such an NDE kind of answer. And you can see the religious affiliations here. We didn't have any Muslims. We're going to hear about Muslim NDEs later today. But as research would indicate, a little over half the people identified as spiritual but not religious, and a few that said no spirituality or religious affiliation. And then there was other, and we don't know what was in there in that group. Currently, it's just kind of interesting to see that the predominance was people who were liberally considered themselves affiliated with liberal religious or spiritual beliefs. And then these 88 people reported 106 total NDEs and 188 incidents of disclosure. So our 37 people reported one incident, 21 reported 2, and 30 reported 3 or more. So our N actually was 188 because we're looking at incidents of disclosure and to the extent to which they were helpful or harmful. The NDE scale, again, showed itself to be very reliable with what we're looking for is something 0.8 or higher. 0.7 means it's pretty reliable, it's good enough. Because it was in that not really confident range, we used just total NDE scale score instead of using the subscales. So here's the needs, and the reliability there was excellent. We had above 0.8 for the total scale and each of the subscales. And our factor analysis revealed that there was essentially one factor that we just called quality of disclosure experience, that it was either good/positive, it was neutral, or it was bad/negative experience. Each item correlated strongly or moderately with this factor, so we kept all the items and used them in our analysis. Again, we used total scores rather than subscales. And the needs correlated with 3 items. We asked, in addition to the needs, we asked each person, how positive or negative do you consider the disclosure experience? And so what this shows is that if the person ended up with a needs score showing that the confidants responded that it wasn't real, they pathologized the person, they demonized the person or the experience, then people said that was a negative experience. If their score on the needs scale indicated that that the confidant indicated that the experience, they reacted like the experience was or at least could have been real, they didn't pathologize the person, they didn't demonize the person, then the person answered that that was a good experience. We also asked how pleasant, emotionally pleasant or distressing did you find the disclosure experience? And again, there was a very strong correlation between need scores and how people answered this in the direction you would expect. The reason, for those of you who are statistically oriented, the reason the correlation is negative is that if the NDE, the needs score was low, then they would have answered high on this question. So it creates a kind of a negative relationship. And how helpful or harmful did you find it? Again, it was a very strong relationship between how they answered the needs and how they answered this question. So all of this suggests very strongly that what the needs assesses is what people find to be positive or negative, pleasant or distressful, helpful or harmful. That it really does have to do with the reality, the recognizing, the pathologizing, all those factors. So our results, we wanted to again look at the relationship between need scores and various other phenomena. So first, what type of professionals did NDErs disclose to, and how many of each type? So because of our numbers, we had to combine people. So we put physicians, nurses, EMTs, and psychiatrists into one category. It's questionable whether psychiatrists belong in medical or social, or psychological. But we did it this way. Oh dear. And then we had counselors, psychologists, social workers in the mental health category, and clergy and chaplains in the religious or spiritual category. And so, as you see, most of the disclosures were to medical professionals, then mental health, then religious. And one of the interesting things was we explicitly asked for disclosure to health professionals, but it's like the NDErs really wanted to tell us about their disclosure to their family and friends. So I'm showing you those numbers as well. So what was the quality of their experiences with these different professionals? And remember that 1 is a good experience and 7 is a bad experience, and 4 is neutral. And so the total mean scores for each of these professional groups ranged from 1 to 7, with the overall mean being 2.97. So if you think about 4 is neutral, 1 is positive. Overall, out of all the disclosure experiences that our participants reported on, the mean was in the positive direction. So even though I think in the past the literature has focused on disastrous experiences of disclosure, and certainly, those are important, but they may not represent people's experiences overall. However, on the positive side of neutral. However, when we looked at professional group, these are the range of mean scores. So 1 is a really wonderful, couldn't have been better. They probably told Bruce Grayson about their NDE, couldn't have had a better experience of disclosure. 7 is horrible, awful, very bad, couldn't have been worse experience. And what you see is in the medical group, you've got the full range. In the mental health group, you've got the almost full range, with one thing being just short of the worst possible. In the religious group, the full range, and with family and friends, the full range. So the disastrous experiences are happening, and in all groups. And what we found was, even though you see the numbers look a little bit higher for the medical and, kind of get a little bit better for the family and friends, because remember, again, 1 is more positive, we actually found no significant difference in those scores. So NDErs' most noteworthy disclosure experiences were not significantly better or worse with any particular professional group, at least among this group of participants. And so the good news is that NDErs' most noteworthy experiences were, on average, mildly positive, with ideal experiences in every group. But the bad news is that the worst possible experiences also occurred in every professional group. So how about year of NDEs? As people have had NDEs more recently, have those people had more positive disclosure experiences because there's been more information out there for healthcare professionals to be able to respond helpfully? And what we found, first of all, our NDEs ranged from 1934 to 2010, and the year, and this is the really important finding, the year did not significantly predict the need score. In other words, NDErs' experiences of disclosure haven't changed significantly over the past 80 years. I know, right? With all the information that's out there, you saw, if you were here for the first Bruce's presentation last hour, that article on responding, in a clinical way, clinically helpful way to near-death experiencers. That article is probably 30 years old or something. I mean, the information has been, and there's been a lot more since then, but somehow that information has not filtered down to the front lines where people are actually talking with near-death experiencers. So that was a surprise. Now, a limitation is that we didn't ask the year that the person disclosed. We only asked the year of their NDE. But presumably, if you didn't have an NDE until 2008, you couldn't have disclosed it until then. And if you had one in 1934, you probably disclosed it earlier. So we're assuming that that relationship that in future research should really be addressed explicitly. How soon after your NDE did you disclose it? And we asked, they could answer anything from immediately to after more than a year. And I keep pressing the wrong button. And I don't know if you can see this number, but essentially the trend is to go kind of down this way, that the immediate was mostly to medical professionals, and after a year, after a year, percentage-wise, there's a tendency for people to disclose to family and friends relatively later. And mental health and religious professionals are kind of in the middle there. So we didn't include family and friends in this one, but here you can see most of the disclosures occurred after a year to professionals. So we found a significant difference between related to how soon the NDER disclosed and what professional group they disclosed to. And they do disclose significantly sooner to medical than to other health professionals. So this finding actually kind of corroborated previous indications from other research. How soon NDErs disclose the needs scale? The sooner the NDER disclosed their experience, the worse their experience of disclosure. So you can probably imagine some reasons why that might be the case. We don't know. We're just speculating here. But the possibility that early on, if the person really, some NDErs don't want to talk about it at all, but some really want to talk, and if they talk and they're not being very discerning about who they talk to, they may make poor choices of who to confide in. And also, it may be that early on there's a lot of strong emotion often related to NDEs, and the person may be very emotional, which may kind of put off the confidant. So this is another thing for future research to investigate exactly what's going on when with those early disclosures that were so harmful and painful for the near-death experiencers. And then finally, is there a relationship between how deep the NDE is and the positiveness or negativeness of the disclosure experience? And we found a positive correlation with a small effect. And the deeper the NDE, the more negative the NDEr's disclosure experience. And again, I see a couple nodding heads like, that makes sense, because so it's one thing for Leslie to say, I observed the car rolling over 3 times from a position up in the air. And the healthcare professional goes, and says, maybe you'd like to talk with a counselor about that, But what if she had said, so I observed the car roll over 3 times, and I was from this position up in the air. And then I moved really rapidly. Suddenly I was in a tunnel, and I moved really rapidly through it, and my grandmother was there, except she died 20 years ago. And then I talked to Jesus, and so the deeper the experience, the more features it has, the more the health professional, the ignorant health professional, is likely to go, Wah! And so we think that's what's going on there, again, for future research to really confirm. So the tendency for deeper NDErs to have worse disclosure experiences was not more or less likely based on the confidant's professional group. So again, didn't matter whether it was medical professional or religious professional, if they disclosed a deeper NDE, they got a more negative reaction, a trend. It doesn't mean in every case, but there is a tendency in that direction. So, to summarize, more noteworthy experiences of disclosure to medical than to mental or religious health professionals. Good disclosure experiences slightly outweighed bad ones overall. Disclosure experiences from very good to very bad with professionals from all groups, with no group overall better or worse than another. Quality of disclosure experiences hasn't changed over the past 7 decades, despite increased information over the past 4. And NDErs disclose sooner to medical than other health professionals. In all groups, the sooner after the NDE it was disclosed, the worse the disclosure experience. And the deeper the NDE, the worse the disclosure experience, with, again, no difference based on confidant's professional affiliation. So some professionals in every category have served NDErs well. That's the good news. And so our thinking is, well, if some can do it, maybe or likely more can, with education and knowledge and some attitude adjustment, maybe. And so we do have some best practice recommendations. In particular, all professionals need to develop knowledge and attitudes that help and don't harm those most in need. Every professional in all of those categories has ethics that mandate that they do no harm, but we are doing harm, and we need to stop that. And the way we stop it is to become knowledgeable and respond in ways that do recognize the experience, acknowledge its at least potential reality, don't pathologize the person or the experience, and don't demonize it. And especially to those most in need, NDErs disclosing soon after the NDE, they're very vulnerable. They've just had an experience that defied any previous reality, and there's a lot to integrate. And they, more than anyone, need helpful responses, and those are the ones that we seem to be hurting the most. And also those with relatively deeper NDEs that have lots of features that, again, are different from the person's previous experience of reality. There's a lot to integrate there, and again, those are the people we seem to be doing the most harm to. So also good news is that we now have this instrument that seems to capture the quality of disclosure experiences. And so it really shows promise as an assessment tool for future research. So for example, we could design a study now where we have NDErs disclosing their experience, and if they find that this would be like in a research study, and for those people, those health professionals who are responding in the harmful ways, providing some education and then have NDErs again disclose their experience and see whether, and ask the NDErs the first time they disclose and those the second time, what was the quality of their experience. Hopefully it's going to get more positive, and the needs can help us determine what kinds of interventions are helping people have more positive experience, NDErs have more positive experiences of disclosure. So here's some recommendations. I've devised this kind of thing based on the NDE acronym, and we start with the Ds. These are like don't do these things, and then the Ns are the things to enact, the things to do instead, and E is the effects of the Ns on the NDEr. And so, for example, don't disregard the possibility of an NDE. I recently completed a book, and I think it's going to be for sale here at the bookstore, on drowning near-death experiences. And we're recommending to life safety, water safety professionals that even when they're in the process of searching for someone who's thought to have drowned, to be thinking things and maybe even saying out loud, I'm looking for you. Because the person might be having an NDE and might actually be observing and hearing or reading the thoughts of people related to their eventual resuscitation. So narrate what you're doing. If you're actually in the resuscitation process, say what you're doing. I'm doing what I can to bring you back to life. Oh yeah, there it is. And then the NDEr, presuming they're having an NDE, will feel elucidated as to what is going on and what your intentions are in relation to him or her. Even though, of course, you have to be aware that the person very well may not want to come back, but you can still tell them you're trying to bring them back. Don't discourage the NDEr from talking about it. Once the person is resuscitated, they start to talk about an NDE, let them, encourage them, even invite them to talk about it. Did anything unusual happen, or what do you remember from your experience? Thanks. Tell me about it. And so the person feels encouraged to discuss it. Don't deny the NDE as an experience that has been recognized and labeled. Instead, know and name the experience as an NDE. Now, that doesn't mean you have to, get into an argument with the person about whether or not it was, but just to let them know that there is a known phenomenon that may very well be what they experienced. And many people find a lot of relief in that, as Leslie would have. Then the NDEr will be educated that it's a known phenomenon with a name. Don't disbelieve that the NDE could be real, but rather naturalize it as a real or at least potentially real experience. So the NDEr feels endorsed that they've had a real or potentially real experience, as Leslie would have appreciated. Don't diagnose the NDEr as mentally ill on the basis of the experience alone. Normalize it, because as far as we can tell, maybe 1 in 5 people who survives a close brush with death will remember a near-death experience. So it's a common experience. So they'll feel equalized rather than separated into the crazy category. Don't demonize it as spiritually evil or malevolent, but rather pneumonize it as a spiritually neutral or potentially benevolent or actually benevolent experience. And as you saw from Dr. Grayson's presentation, people often do move in directions that by any religious or spiritual criteria would be considered more spiritual. People become less materialistic, more concerned about others, and so forth, more spiritual in themselves. So they feel enlightened that the experience was not inherently evil, is potentially spiritually beneficial. Don't determine the meaning of the NDE for the person, but rather inquire about what meaning they make of the experience. Ask, what does it mean to you? so the person feels empowered to reflect on and generate their own meaning, which may evolve over time. And don't deprive the NDER of resources, but rather navigate them toward resources so they feel equipped to find further information and support if they want it. And this is a little summary of those points. And some of the recommended resources that I like to suggest to people are these. Audiovisuals and online, INs and NDERF. There's a continuing education course for healthcare professionals online. And I wanted to give Leslie the last word. Well, is there anything else that you would want to say about your experiences of disclosing your NDE to anybody? Health professionals, family, anybody else?
I would definitely say that if, doctors who are in a position who meet people who've gone through, traumatic experiences, accidents, who are very, very ill, who may have these kinds of things, just to make sure that they know what near-death experiences are, make sure that they're familiar with it and that they can talk to the patients and make sure that the patients understand that it's okay to have had the experience, it's okay to talk about it, and that it's valid and you're not crazy if you experience something like that.
Yeah. Okay. Thank you very much for your attention. Thanks.